And the recording has started. Dr. Alvarez, are you there?
Hello. Hi, Nina. Hello, everyone. And wow, what a good turnout. We've got a lot of patients here listening, and they're still coming in, right, Nina?
They are coming in still.
Very good. Yeah. So I think, what is it, 2, 3 o'clock, 3 minutes after?
It's
I, I think we can, would you like to start already? Or
Yep,
do you want to wait?
let's get started.
All right, let's get started then. I'm with you. All right, so hello everyone. I'm Dr. Alvarez, and most of you know me. Maybe you're a former patient of mine. Maybe you heard about me online. Maybe you heard about our practice and the way we work, and maybe you were referred by another patient. And I'm from endobariatric.com, and it's a pleasure to be here. And I want to thank you for taking the time on a Saturday to learn a little bit more about our practice and learn a little bit more about this spectacular procedure called the gastric sleeve, something we've been doing for almost 10 years now. All right, so I'm gonna, as Nina was telling you, I'm gonna go fairly quick through a lot of common sense stuff that you've learned and you've seen and you've read yourself. So first of all, why weight loss surgery? And it is very well known that bariatric surgery or weight loss surgery will give you a long-lasting treatment for obesity, but it also will give you a lot, it would be the best treatment for metabolic or other medical conditions like type 2 diabetes, high blood pressure, fatty liver, sleep apnea, cholesterol, triglycerides, among other situations that we'll see shortly. So these procedures are now done laparoscopically. We don't open patients up. They're really short procedures. Patients recover really quick since they're tiny incisions. And it's a big boom nowadays. And now this procedure, gastric sleeve, I was in LA this 2 months ago, and it seems that the gastric sleeve in 2014 was the most popular procedure, it was the surgical procedure with more numbers done in the U.S. Regarding weight loss surgery. Why is this? Because this procedure is very safe. It's a procedure that gives amazing results, and it's done in our practice at 25-35 minutes. So it's a big deal. Changes your life in 25 minutes, and it's an amazing tool that, if used properly, will give you the sky's the limit, the outcome you desire.
Hey, Dr.
So these
Alvarez,
are just
can I stop here? Can you go back? I want people to
thing.
know that was really a picture of you and your team, part of your team, actually in the surgery room. Can you introduce those gentlemen?
Yes, of course. So the lady on the back is one of my OR nurses. I have 3, and she has been with me for 9 years. And then we have on my right-hand side, I'm the guy in the middle. On the right-hand side, you have Dr. Gabe with a black surgical cap. And then with a blue surgical cap, that's Dr. Alvarez. So Dr. Gabe and myself, we've been working together for 8 years every single day. But we've known each other since 2001. So almost 15 years. And he was, when I was a senior resident, he was a year underneath me. So I've always been coaching him through surgical residence. And then once he graduated, I had a good practice, and I invited him over, and he came down, and we've been working together all since then. And then on my left side is Dr. Asa. He's a former patient. We've done his surgery, his gastric sleeve. We've done his mom's surgery. We've done his sister-in-law. We've done quite a few members from his family. And he's my right hand, and helps me with doing the rounds, helps me in the OR, helps me with a lot of stuff here in my office. So That's part of my team. You want to? I don't think we have a picture of my whole team, but it's at the same time in the OR you get to meet 14, 15 of my staff members just focusing on you. So those are the ones that you see in that picture. Continuing with why weight loss surgery, these are some of the major journals, newspapers in the United States, and what they have to say about weight loss surgery, and they will all conclude that having weight loss surgery will increase your lifespan, you'll live longer, in other words, and you'll have a much better quality of life. Every single study will actually point that way. Something happened. Give me a second.
You're going really fast now through them.
You know, it was a keyboard. Anyway, I'm back. Give me a second. Here we go. I'm sorry. It was technical. Here the keyboard went crazy. So the newest trend, newest information is that having weight loss surgery will help you with your diabetes. So this is what we call an anti-metabolic effect. So metabolic syndrome is called a series of medical issues like high blood pressure, diabetes, cholesterol, triglycerides, arthritis, sleep apnea, a series of these diseases together along with obesity is called a metabolic syndrome. So we've noticed that once you get the surgery, you not only lose the weight, but this metabolic syndrome reverses, disappears, or just simply gets better. Such is the case with type 2 diabetes. We've noticed that type 2 diabetes, in the vast majority of cases, gets better. If you're getting insulin shots, you'll probably come down to meds. If you're on meds, you'll probably go on nothing anymore. You'll drop all the medications. So depends on a lot of factors, of course, and we can go over those in your particular case. But the thing is that weight loss surgery not only is beneficial on the weight, but also in other medical conditions. And these are just a few right here. So this is cut out from the ASMBS, the American Society for Metabolic and Bariatric Surgery, which is the maximum authority of weight loss surgery in the United States. And you can see underneath each medical condition the percentage of resolution. That means the percentage of the patients that get their problem resolved. So it's quite amazing. These percentages are, in general, they're not specific to any particular procedure, like the gastric bypass or gastric sleeve. But the most important thing I want to go over is all the way to the bottom. You see quality of life and you see mortality. So even though everything gets better, the quality of life is improved in 95% of the patients. That is the most important thing. I mean, let's say you have a few pounds overweight, but your quality of life is good, that's fine. But you have no idea how better it gets, how better the quality of life gets, how better you'll sleep, how better you'll feel in the morning, rested, a lot more energy, I mean, motivated, want to go do exercise, go outside, do other things, go out dating, meet other people. I mean, it'll help your work. It'll help all around, you know, your psychological issues. Everything gets better. So that's a really important number. The quality of life is improved in 95% of the patients. And the mortality rate, here goes. Everybody on this seminar, everybody, including myself, we have a certain mortality rate. That means a percentage of the probability of dying in the next 5 or 10 years. This percentage, of course, will go higher if we have certain medical conditions. Just to state a few, if you have diabetes, the percentage goes higher. If you have high blood pressure, it goes higher. If you're obese, it goes higher, etc. So by having surgery, your mortality will be reduced 89% in the next 5 years. So it's just amazing, amazing that that is why the journals have concluded that these two things, your quality of life will be much better, you'll live better, and you'll live longer. So how do we achieve this? And this is done by a simple procedure called gastric sleeve. I placed it up there at gastric what? Because the gastric sleeve gets several names: gastric sleeve, vertical sleeve gastrectomy, sleeve gastrectomy, etc. So, but the procedure is the same thing. They're all synonyms. And what we do in this procedure is, and I'll get my mouse here out, is that what we do is we cut out part of the stomach. It sounds super drastic. It's like, you're cutting out what? You're cutting out my stomach? So here goes. Let me brief you in with a little bit of the history of human beings and humankind here on Earth. This stomach is a design of prehistoric times, all right? So what we were designed to do is to be able to hold a good amount of food whenever we could. When, as cavemen or prehistoric times, we would get to hunt something, fish something, and we were able to eat a lot of food at a certain period of time, because we didn't know if we were able to hunt that night, the following day, or the day after. So the body actually holds a lot of food so we can actually get that nutrition, get those calories absorbed, and put them to use. Nowadays, of course, we don't starve for 2 days, nor 1 day. We find Wendy's on each corner. We find Subways inside gas stations. We have, I mean, I can go on and on. So in other words, what we're doing here, and I tell patients, is we're simply cutting part of that stomach you don't need nowadays. It's not that drastic. It takes me 25 minutes to do this procedure. We don't open patients up, as I was mentioning. No big incisions, tiny incisions. You recover really quick. Patients are up and going 2-3 hours after surgery, getting up to the restrooms on their own, and so it's a very nice and simple procedure. The entrance of the food comes through here, which is the esophagus, and this entrance to the stomach is preserved. We do not touch that entrance, and nor the exit. The exit is also reserved. It's kept that way, nor at all. So there's no rerouting of intestines. There's no malnutrition. There's no malnourishment or anything like that. So all your nutrients are absorbed 100%. Remember that the stomach is designed to digest food. It is not designed to absorb food. The absorption comes actually from here on, which is the first portion of the intestine, right? So why does this procedure work? Because two things. You're able to limit the amount of intake that you can actually eat at a certain time. Doctor, how much food will I be able to intake? So to put you an example, if you have a scale from a 1 to 10, you have a 10 right now. You're eating a 10 before surgery. With the procedure, you'll be able to eat about a 3, less than half. Right after surgery, it'll probably be a 1 or 2, and as we progress the following months, it'll be probably a 3 on a scale of 1 to 10, and probably the following years, it'll be a 5. So you will never be able to eat pretty much what you eat before surgery, all right? So number one is restriction of calories every time you sit down. The other thing is this lump right here in the stomach, right here, this is a part of the stomach that we removed, by the way. So this lump right here is called the fundus of the stomach, and that part of the stomach produces what we call a hormone, a peptide called ghrelin. It's a hormone that produces head hunger. And that is very well known that vast majority of the patients who are obese have increased levels of ghrelin in their blood. So that means you'll have more cravings. That means being obese, you have more cravings, you have more desire for food, more head hunger episodes, etc. So right after surgery, 24 hours after the surgery, this ghrelin hormone will drop right away. It's reduced in about 80%. So hunger goes away, cravings go away. It helps a lot. So the hunger goes away, and when you decide to sit down and eat, well, you'll be able to put a third of food of what you currently eat in here, thus, of course, losing weight and keeping you at a much better weight. There it is again. I wanted to just mention in this slide that, again, nothing is bypassed. Unlike the gastric bypass, where a lot of the problems begin by bypassing or rerouting intestines, and there's also no foreign bodies in this procedure at all. So there's no lap band ring, there's no port, there's no maintenance required, there's no need to follow up with fills with doctors down the road. It just simply works. So on this procedure, on this slide, I wanted to just point out that this thin silhouette, this line right here, just outlines the liver. And most of the patients who come to us for surgery have a condition called non-alcoholic fatty liver. In other words, it's a fatty liver. It's normal, it's expected, it's at a certain point with a certain degree of BMI. And that is the reason, that's the reason we put this slide here. That is the reason we ask patients to do a pre-op diet to get that liver in condition for surgery. We'll shrink the liver, make it smaller. We have good space to perform the surgery. And also, it gets you tuned up in the psychological aspect, because you're already tuned up what's to follow after surgery. So it makes life so much simpler. I'm here with the water. All right, so this is my team of doctors. By the way, again, I just want to remind you, as Nina pointed out, if you have any questions, anything, because we're going to have a good amount of time for questions, please just type them in on your right-hand side of the screen where it says questions, and type them in, and I'll go over the questions gladly right after we're finished here with the seminar. So if you see at any point any questions, type them in, and they'll stay there, and we can address them afterwards. So this is my surgical technique. It has a lot to say because we've done over 9,000 patients, actually over 9,300 now. And right now we average 25 minutes. So that means it can take us 19 minutes, or it can take us 35, 40 minutes to perform a sleeve, depending on BMI or other medical conditions. And this magical thing that we do, I wouldn't be able to do it with these men that you see in the screen here. On your left side, again, Dr. Gay, then Dr. Garza, and the third guy, that's myself. And then on your far right-hand side is Dr. Salinas. That's the anesthesiologist, and he's a magician. He's a magician indeed. He's board certified, of course. He has the most number of cases in the region, and he is trained with. He's got a whole bunch of courses on upper airway, difficult airway intubation, critical care, patient management on very high BMI patients, etc. So this is just the team of doctors, and I wanted to introduce them to you. We have a whole bunch of OR nurses, bilingual nurses that take care of you once you come down for surgery, etc. This is Tyler, tall gentleman you see on your left side. Nina, you want to introduce him?
Yeah, let me introduce him. By the way, I didn't say I was one of Dr. Alvarez's patients. So I had surgery in February of 2014, lost 50 pounds very easily. That gentleman right there is my son. He had surgery this year at 315 pounds. He's now 210 pounds. And the day after surgery, less than 24 hours after surgery, he was giving a salsa lesson to those two gals that you see there who are his sleeve sisters. I couldn't believe it. I was down there with Tyler, so I'm the one that took the video, and they were doing a salsa lesson in the hallway.
Wow, yeah. So we placed this slide to actually work with video, but it won't work with the lag it has with the buffering. But if you want to take a look at it, it's on our YouTube channel. All you have to do is probably just go to YouTube and type on the search bar, type in Dr. Alvarez salsa lessons. I'm sure it'll pull up that video. And it's just amazing, so you can have an idea of how fast a patient recovers after this type of surgery. So these patients are salsa dancing 24 hours after your surgery, and they're up and down, walking the hallways quite easily. All right. So very little pain. Everything's managed with meds. Very small number of patients experience nausea. True. Back in 2006, 2007, 2008, we had our surgical technique had a lot more nausea. We switched our surgical technique. I can't tell you what it is, but by switching that detail, by performing the sleeve the way we do, it has reduced the nausea considerably to less than 90%. I mean, less than 90% of the patients don't experience zero nausea. The 10% of patients that may have some nausea, it usually comes in waves, comes and goes, and easily managed with medication. Here we go again. I think, you know what? It's my mouse. I'm sorry. I'm coming back. I'm coming back. I'm coming back. All righty. So these are the incisions that we do. These are the incisions, the laparoscopic incisions that we do for the procedure. As you see them right there, the incisions are enlarged. It'll sound like a cereal commercial. Enlarged to show texture. The incisions are enlarged here for you to see where they are located, but the measurement is actual millimeters, so they're very, very tiny. The ones that say 5 millimeters is actually more or less the size of your pinky's finger nail, so it's very small. Let me show you on an actual patient. So this is 8 months after surgery. You'll see a 5 millimeter incision right here. You'll see another 10 millimeter incision right here. You'll see another one, 12 right here. So that's barely another one right here. So as you can see, they tend to shrink. They become even smaller. And if you take care of them with some special ointments we recommend, they start to vanish over time. So what makes the sleeve better than the lap band? What makes it better than the gastric bypass, or better than any other procedure out there? I can do a seminar only on that. You know, it's a whole bunch of big advantages over any of the other procedures. So one of them is no foreign bodies, no rerotting intestines, no malnutrition deficiencies as with a gastric bypass, no special follow-up as with a lap band, nor with a gastric bypass that need labs every 3 to 4 months. No dumping syndrome, or at least less than 5%. I mean, I could go on and on and on. So no marginal ulcers. The entrance and exit of the stomach stay intact, which is very important because that is rerouted completely in the gastric bypass, etc. So those are just a few. If you want more information on the complete stuff that we have there, at the end, we have a website. You can actually download a complete booklet on more information on this. So who's a candidate for weight loss surgery? Not everybody is, so you need to meet a certain criteria. It's very important. Now, if you are 100 pounds overweight, you automatically qualify for weight loss surgery. If your BMI, body mass index, and we'll go over that in a few minutes, is over 40, automatically a patient. If your BMI is over 30, but you have some sort of medical condition, like diabetes, high blood pressure, lower back pain, swelling of your feet, etc., your BMI doesn't have to be that high to be a candidate. As long as it's over 30, you're a candidate. And of course, the vast majority of the patients have not been able to lose some weight or maintain the weight at least over 5 years with some medical supervision. Of course, vast majority of the patients, well, you know the story, yo-yoing up and down, the yo-yo diet, you're up, you're down, you try this stuff, you're not able to maintain a certain weight. So just coming back to what BMI is, BMI is an equation of your weight and your height, and you type it in at a BMI calculator, and that will bring you that number. It's a range of where your weight should be, all right, depending on your height. So the higher the BMI, the higher risk your medical risk, or your death, your risk of dying, your risk of medical conditions, etc. So what you want is to have that BMI the lowest possible at a good regular normal range. And I think I have a slide on that. So the normal BMI ranges between 19 and 25. Overweight, being overweight, the term overweight is BMI between 25 and 30. And obese between 30 and 35, and severe obesity 35 to 40, and morbid obesity over 40. Here we have two more categories that are not here, which is a BMI over 50, it's called super obesity, and a BMI over 60 is called super obesity. Of course, from here on, you're a candidate for weight loss surgery, and from here on depends on any other medical conditions. So how do I find out what my BMI is? I don't know. So it's quite simple. There are a whole bunch of BMI calculators online. You want to use ours, you can go to, here it is, endobmi.com. It'll take you to our Who's a Candidate page, and you can type in your height, pounds, compute BMI, and it'll tell you what your BMI is. So depending on that, it will let you know if you are a candidate or not. And if you still have some questions, you can always contact us, and we can help you out to figure it out. And if you have some other medical conditions, let you know if you qualify for this procedure or not. So I just wanted to, I know you've probably read some stuff on the gastric sleeve. I didn't want to overload you with a lot of stuff that you probably already know. I have a book on the gastric sleeve, and I'll give you the links at the end of the seminar. And I wanted to show you some of my over 9,000 patients that we've done. This is Sarah, and first of all, I want to tell you that please, if you decide to have surgery, or the former patients that are attending this seminar, please never compare yourself to any other. Everybody is different. Every other patient is different. There are a lot of factors that will dictate the speed or rate at which you lose the weight. Just to bring in with a few, age, of course, the younger you are, the faster you'll lose the weight. Gender, men lose it faster. Sorry, ladies. That's the way it is. Men have more muscle mass, and of course lose it faster. Another thing is activity level. That's very important. I mean, after surgery, some people get like super motivated, attend the gym, they're exercising a lot, and of course the results are seen much faster. So who's that, Nina?
That's my son Tyler. And actually, that was at 80 pounds down. He's now down 105 pounds, so he's thinner than that. But that was his before and after that we chatted, that we took.
Amazing, really good. So quality of life again is improved. I mean, just look at that smile. You can't beat it. One versus the other. It's not just the weight; it's everything all around you. That is Yvonne, our dear Yvonne, and you probably recognize her if you follow us on our private Facebook group. If you want to join, you're welcome to do so. We'll give you the details at the end of the webinar. And Yvonne is always posting, and she's very positive out there. She's at goal at 8 months, and of course the results may vary because this is Anthony, and he lost 140 pounds in 8 months. Of course, The vast majority of my patients don't need to lose 140 pounds. The vast majority of my patients need to lose 40, 50, 60, 70 pounds, 100 pounds, you know. But of course, Anthony started over 500 pounds, and of course, he needs to lose this amount of weight, and that is why I mentioned that everybody's journey is different. But everybody gets an amazing quality of life. Everybody gets motivated. Everybody gets that big smile on their face. This is Keisha, and she was down 100 pounds in the first 5 months, which is fantastic. Of course, the higher BMI at the time of surgery, the faster you lose the weight. The lower your BMI, the slower you lose the weight. But wait, it will come off. It will just come off slower because the higher BMI, the more you have where to burn, you know. So the higher the BMI, it's simpler to lose the weight faster. As you start to progress and start to lose the weight, it will come slower down. So just keep that in mind. Of course, I get a lot of, I'm honored to receive a lot of medical doctors, professionals in the medical field that come to our office every week. We get an average of 3 to 5 nurses per week. It's just amazing from the U.S. And it means a lot. It's a big honor because nurses, people in the medical field do extra research. They research medical credentials. They'll research continuing medical education. They'll research other factors that are only known by medical professionals. In this case, this is Dr. Chapa, and Dr. Chapa wasn't actually so much involved in losing that belly. He walked into my office, and I told him, I know him, he's a local doctor, and I go, "Yeah, what's up, doctor? You want to lose that belly?" He goes, "No, forget the belly. I want to lose the diabetes." So we did his surgery because of the diabetes, not much because of the weight. Of course, he was going to lose the weight. Lost the weight, and no more diabetes for him. So it's a big honor to receive all these medical professionals. Now, how can you get the most out of this procedure? Attention, people who are out there listening that are former patients of mine or from other doctors. Here goes. So, of course, everybody jumps from point A to point B, and of course, they're thrilled at this point. This is a patient of mine, dear patient of mine from Miami, where everything is sun, bikinis, and beautiful women. So this patient of mine contacted me, and she wanted to lose more weight from here, and we put her on, we recommend always going on a serious low-carb diet and increased activity levels. So if you, let's say you get on an elliptical machine 4 times a week and you lower your carb intake, counting carbs, I can show you how to do that, your results will be spectacular. Of course, we've had patients from The Biggest Loser. We've had a few coming from there. Excuse me. Here with the water again. This is Betty Sue, and she started at the show at 261 pounds, and she lost 75 pounds on the show. And I told Betty Sue, you lost 75 pounds. I mean, you did really good. What happened? Well, the results are unreal because the lifestyle is very unreal. I mean, you're eating 1,200 calories per day given to you by a nutritionist. Here's the food. It adds up 1,200 calories a day. Then you're exercising. You're busting your butt off for up to 8 hours in the gym with personal trainers. Of course, people lose the weight, but of course that lifestyle is not maintainable, which is the key here. And that is why the weight is not maintainable. So that is a picture of Betty Sue in my office the day of surgery. This is after surgery. And it's just amazing how you're able to maintain weight easier, look better, and adapts. The most important thing is adapts to your lifestyle. All right, you don't have to do much to it. I know you're a mom. I know you work. I know you're busy at work. I know you are a dad that supports the family. You got to be at work really quick, recover really quick, which is the surgery does this for you. And it adapts to your lifestyle. So you're simply going to be eating pretty much everything you can eat right now, just a third of what you're currently eating. And that's what produces these results. This is David Scott. This is Sean William Scott, the actor in American Pie movies, Stifler, in other words. And this is David Scott. He came into my office, and we became really good friends. And look at him after. It's just amazing when you want to get the most out of it. Because, I mean, you can get the surgery, lose the weight, and you'll be happy. But if you want to get the most out of it, you want to get serious, you can do so. And as I was telling you, the sky is the limit. Now, he looks like a movie star. So how about you? How about you? If you've been thinking about doing this, there's always a spot for you, because this is something you can do. This is something you can achieve. Don't think it's, well, it's these people, it's these before and afters, probably. It's just probably these few cases. No, no, no. You can do it. I can assure you can do it. If you go into my website, we've got close to 400 before and after testimonials that we have. It's probably the website with the most before and afters, just focused on the gastric sleeve. So this is definitely something you can do. So we've put together a really important guide, a really good guide, a really complete guide that is completely free for you. All right? It's completely free. We give it to you. And I know it will answer a whole bunch of stuff for you that may come right now, may come afterwards. All right. You want to download that file? All you have to do is go to gastricsleeveinformation.com, and you can download that complete guide. Believe me, when I say complete, people, it is complete. All right. So you will have a very complete notion of what the procedure does, what to expect, all the aspects. All right. You can also you'll also learn is it safe? Will it help me? What to expect from it? What happens down the road, etc. So again, the website is gastricsleeveinformation.com, and it will ask you just your information that you already used to register to the webinar, and you can download that guide for free. It also involves financing options, pricing, and some other information that I know will be that is very crucial too. Again, the website is gastricsleeveinformation.com. I want to remind you that we are very active on social media. Believe me, I have an addiction to this. I manage my own social media, so you can always search us at Endobariatric on any of these platforms, or if you also like to use, let's say, Snapchat, I'm there. My username is Guillermo Alvarez. The other thing is I wanted to, here it goes. I think I have a slide there. I want to invite you, if you haven't seen the AskDrA Show, I have a weekly show on YouTube, and we pick up questions from all over the world. We compile them, and we do a weekly show called the AskDrA Show. So in case you want to ask some questions through any of the platforms you see down there, all you have to do is use the hashtag AskDrA, and we'll pick it up, and I'll do what I'll do is answer your question as a video on that show. So it's really fun. I have a lot of fun doing it. And if you want to check out the previous shows, you can do so by going to the AskDrAShow.com. All right. So, Nina, we have any other information here?
Yeah, we've got some questions, Dr. Alvarez. Why don't you back up and have the slide that has that website in case they didn't get it and they can have time to write it down. Perfect. Okay, so some of these questions you've already covered. I'm going to read them so that the people know that I have seen them. First question is, what exactly is the gastric sleeve surgery? You have obviously well covered that. Next question, what is the lowest BMI patient you will accept? I'm here with my sister, and she has a BMI of 28.5. She is pre-diabetic, has high blood pressure, high cholesterol, and severe joint pain. morbid obesity runs in our family. She has to wait until she has, is she,
Yes. Okay, so what is she a candidate?
is
Does
she
she
a
have to
candidate?
wait? Can we do
Yeah.
surgery right away? Yeah.
Yep.
Okay, so no, by guideline, she cannot have surgery. But since she's a pre-diabetic, if she does gain a few extra pounds, we would be able to take her as a patient because of her pre-diabetes condition, all right? But if she's not, it's very it's not ethical. I can't do a patient with a. Although I know maybe some other doctors would. In my practice, no, we follow the guidelines to the T.
Okay, is the sleeve better or the bypass? I think you've covered that very, very much. It's the only reason.
I can actually throw in a little extra information there.
Okay.
My mom had weight loss surgery. I did her surgery, and guess what procedure I did on her? Of course, the gastric sleeve. So if it's good for my mom, and I've seen all the progress, and I've written books on this, believe me, I truly believe on this specific procedure. You will not have the malabsorption problems, the anemia problems down the road, the malnutrition, it's a whole bunch of stuff. So by far, the gastric sleeve.
Okay, describe the nature of a re-sleeve procedure and how does the doctor determine the amount of stretched stomach that can be removed?
All right, so we get more and more requests from patients, mainly from other doctors that have a very big sleeve, or they did their sleeve kind of wide and it started to wind up a little bit down the road, and they want to re-sleeve. So that's what they're talking about here. They want to re-sleeve, make that sleeve smaller. Can it be done? Number one, yes, it can be done. Have we done it? Yes. We do get quite a few cases a year. We do require patients to get an upper endoscopy and a barium salt to see that stomach, to see the dimensions of the stomach, and if we recommend getting that done. So we do the procedure. That's what's needed, at least in our practice, to get going. But you can always contact my office, and we can bring you in with more information on that.
Okay, next question. Any long-term studies done to see any long-term effects of the gastric sleeve surgery?
Oh yeah, definitely. When you say long-term, some people may say 5 years. Some people may say 10 years. Some people may say 13, 15 years. There are studies out there. The results are really good. Believe me when I tell you that last year, 2014, the most popular weight loss surgery in the United States was the gastric sleeve for first time in the history, because it used to be the gastric bypass. It's because it works, because it's less complications down the road, better results, and much simpler procedure, much quicker, less risk.
Okay, down the road after surgery, can the stomach re-stretch to enable weight gain again?
All right, so what we were talking about a few minutes ago with a re-sleeve candidate, some people that get a sleeve done, their initial sleeve was kind of wide. They used a bougie calibration tube, which is kind of wide. Can have a little easier tendency to have some weight regain. It's very difficult now. Let me bring you in this information. Very difficult to actually come all the way to the starting point where you were. No, because the stomach will never ever stretch out to that point. All right, it gives in a bit, about 3 to 5%. It gives in the next 5 years. So the more you leave, the easier it is, excuse me, for it to stretch out. In our practice, to prevent this, we use a low BMI, a low number of bougie. We use a 32 French bougie. That means we cut out all the stretchy part. Very difficult for it to come back, and we oversew the staple line.
Next question. Will the procedure void any existing life insurance policies in the United States?
No. No, it shouldn't void anything, because it's a known procedure. It's authorized. by the ASMBS in the U.S. It's authorized here. So it's a known procedure. Let me tell you this, what your insurance company knows, your life insurance, you're more probably to die at the amount of weight you are right now, the number of the pounds you're at right now, than getting surgery and living more years. So why would they avoid it? So it's something that is well known. They know it. The insurance company knows that getting this type of procedure. I just showed you. I mean, all the statements done by the journals in the U.S. and the press. It'll give you extra quality of life, extra years of life. So of course, it won't void anything.
Okay, next question, and then I'm going to add on to this question a little bit. This question is, how long will the surgery take? You've answered that, but I think I'd like you to talk a little bit, Dr. Alvarez, how your process is a little different. I'm on a lot of Facebook groups prior to having surgery with you, and then afterwards, and I hear a lot about catheterization and drainage things and all of that kind of stuff. So can you talk a little bit about that?
Yeah, so I used to place drains in my patients. I probably placed over 350 drains. And the thing is that the drain is maybe misleading, all right? So I don't like using drains. My staff, what you get with our practice is quality healthcare. You get to see me, my staff, my doctors. You see us 2, 3, 4 times a day. Why? Because I sounded like the Mickey Mouse Club. Why? Because we like you. No. Why? Because we're actually looking out for you because we want to make sure your vitals look good, make sure your abdomen is good. We check on your tummy a lot. We make sure your bowel sounds are moving good. Everything is good. Everything is flowing the way it should. So why? Because we used to use the drains, but as I was telling you, it may be misleading. What happens if you place a drain inside your tummy? The drain is only set at a certain area of your tummy, and you start to bleed at another point. That is not where your drain is. Or you have a leak where the drain is not placed. And you see the patient start to deteriorate. And you say, wait a minute, but there's nothing going on inside because the drain is clear. The drain is perfect. So, and you're not putting attention to this patient the way you should because you're focusing on one misleading thing, which is the drain. So that is the main reason we don't focus on the drain. We don't focus on one single thing. We have a certain parameters we come and check on you every time we come and see you. So we are able to pick up a leak, bleeding something really quick, much quicker than a drain. That is the reason we don't use drains. Number 2, catheters, urinary catheters. I don't like them because those are mainly used for longer procedures. This is a 25-minute surgery. Anybody can last 25 minutes without peeing. So what we ask the patient to do, go empty your bladder before getting on the gurney, before going to the OR. And everybody after surgery, 2 or 3 hours after surgery, they get up on themselves and go up to the restroom and pee. That is why we don't use this stuff.
Okay, next question. Does this procedure help with snoring even if it's not actually sleep apnea?
Yes, indeed. Yes, indeed. I've seen the snoring disappear as rapidly as 4 to 5 weeks post-op. Because even though you're not diagnosed with sleep apnea, the snoring has a lot to do with the fat tissue around your pharynx, the upper airway, and that starts to go away right immediately after surgery. So it does help, definitely.
Can you please speak about life after 1 year after surgery or even 2 years after and about losing hair?
Yeah, I can speak 1, 2, 3, 6 years, 7 years, 8 years. Actually, we do have some videos on our YouTube channel that talk about that. If you go to our YouTube channel, youtube.com/endobariatric, and of course, the website down there that you're seeing right now, in the booklet you'll find all this information. And you'll see videos of patients a certain time because I wanted to get that out to you guys. I wanted to get I actually have 1 month out, 3 months out, 6 months out, 1 month, 1 year out, 2, 3, 4, 5, 6, all the way to 8 or 9, I believe. So you can actually see these people testimonials talk about this. But Nina, maybe you can help me out here. You're a patient.
Yeah, you know what? I remember at the very beginning, people said by the time you got to 9 months, you would forget you'd had the surgery, and that was about right. Um, you know, by that time, everything is so normal. I mean, you eat, you look. Here's what's going to happen, Dr. Alvarez. They will watch people eat, and they will think, "Oh my goodness, how in the world can they eat that much food?" And yet you
Uh,
think about that's what you were eating. I mean, it's just not possible. I'll tell people a buffet, you will never be able to go to a buffet restaurant again unless you're willing to pay a whole bunch of money for a very little amount of food. So otherwise, it becomes normal. It really becomes normal.
a new
Um,
lifestyle. Right?
it's a new lifestyle, and I love it because I don't know. I don't know. It's just really nice not to think about food all the time and having to, do all of that kind of stuff. As far as the hair loss, I have fine hair anyway. I must have lost a little bit, but I know you have some recommendations with vitamins. Biotin is one of them. You like the skin, hair, and nails from GNC and different things like that. So, and then the protein. So getting all of those kind of things, nobody goes bald. You might lose a little bit, but it comes back in. So
Yep, indeed. So we have the recommendations. We do have uh, some biotin. We have zinc. We have the hair, skin, and nail supplement they sell at GNC is really good, etc. As Nina was stating, I've never seen so far a bald bariatric patient. All right, so nobody goes completely bald. Every single hair regrows. The supplements help, and believe me, the last thing you want to worry about is your hair versus your medical conditions prior to surgery. Those medical conditions can kill you, and if you have a little bit of hair thinning, that won't kill you. All right. Well, I have some hair thinning, but that unfortunately, my hair thinning doesn't come back like yours.
okay, next one. Hi, Dr. A. I'm having surgery with you on next Friday! Exclamation, exclamation. Sounds like she's really excited. Or
Yeah.
Michael. Maybe it's Michael, so it might be him. Any tips to help limit loose skin after surgery?
Yeah. Yes, indeed. Of course, the exercise activity, your level of activity after surgery has a lot to do. Age has a lot to do. And keeping your skin well hydrated is very important after surgery. So I recommend a really good hydrating cream, applied morning and evening for the first 12 to 18 months. It helps a lot. So of course, a lot of other factors come into play, your genetics and your age and your gender, as I was telling you a few minutes ago. But keeping what you can do is exercise, hydrate well, good amount of water per day, and apply a good hydrating cream.
Well, the next one is a testimonial for you, Dr. Alvarez. It says, this is from Victor. I am a true testimony. The best team. This surgery saved my life. He didn't have any questions, but he just wanted to tell you that.
That is my friend Victor. See,
Yeah.
Victor is a patient of mine, but we get to have a lot of fun on social media, as I was telling you. So Victor texts me in the morning, and then I text him back, and we fool around in Snapchat, and he tells me and shows me on Snapchat what he's having for dinner, and I can show him, and I can show and post it to the rest of my patients. So it's kind of fun.
Okay, the next question is from Teresa. Will you have a better chance to have children after this surgery?
Definitely. I get a lot of referrals from the OBGYNs. Why? Because they have a lot of patients with PCOS, infertility issues, and it's because they're overweight. Once you have surgery, I always tell my patients, please, please, please don't get pregnant in the next 12 months, because your body's going to be transformed. Your body's losing a whole bunch of weight in this period of time, and it's not optimal to actually to get pregnant at that point. You can't get pregnant. It's going to be way easier after 12, 18 months and once your weight is stabilized. Your OBGYN knows this. They know about the reversal of the PCOS. They know that it skyrockets fertility. And, of course, you'll have a better, safer pregnancy for you and your baby down the road than if you would get pregnant right now.
Okay, next question. What is the best way to eliminate shoulder joint pain from the injected gas?
Okay, so the shoulder pain usually lasts between 6 to 12 hours right after surgery. If the patient had some other procedure done, let's say a hiatal hernia repair with the sleeve, you may have a little extra shoulder pains, but normally the gas is it's CO2. It's absorbed in the next 6 to 12 hours, and then it goes away. But we manage that with regular pain medication through the IV, and of course we send patients home with medications for pain too. That's all included too in the package.
Well, and isn't the walking that we did in the hallways help too?
That's the best medication right there.
Yep. Next question from Connie. How long until a person can go back to work at a desk job? Let me answer that from both my perspective and my son's perspective, and then you can answer, Dr. Alvarez. I had surgery with you on Friday. I was back to work on Tuesday, desk job. Tyler had surgery with you on Tuesday or on Wednesday and was back to work on Sunday, and it was not a desk job. So less than a week for both of us.
Yeah, it's more or less 3 to 5 days is the average. 7 is more than enough.
Okay, do you work with patient's doctor in the United States after surgery?
Again, the question, Nina?
Do you work with the patient's doctor in the United States after surgery?
Yes, actually we get a lot of referrals from doctors in the States, primary health physicians that refer patients to us, and of course they see the patients afterwards. But of course we do a lot of the follow-up directly online. We have a special online system that we touch base with patients at a certain period of time, starting from once they get home, 7 days after, 2 weeks after, 21 days, and so on and so forth for the following year. But we do work with doctors in the U.S.
Yeah, in fact, when I worked, the first time I went to my doctor afterwards, he was really impressed and wanted to know a lot about you. He was amazed. Next question. I have gastritis. It is getting better. Will having surgery affect this or make it worse?
No, gastritis is totally independent. Reflux, on the other hand, you may experience a little reflux after surgery if you do have reflux before the surgery. But gastritis is totally independent.
Okay, we got a question about being catheterized. I think we answered that. They wondered whether or not that they would have to do that. So, and so next question: after surgery, is there a need to use? Looks like they moved on. Use something for the bypass. You didn't. That question didn't get finished. I don't know what they meant.
No worries.
Do you cut the stomach open? Obviously, no.
No.
Will I have to take vitamins and minerals for the rest of my life because not able to digest all of the nutrition I need?
The answer is no. I recommend vitamins for the first year only. So let me bring in with a little secret. First 250 sleeves we didn't give out any supplements whatsoever. So it's not that it's obligated. It's something that nothing happens. But I prefer my patients get 100% supplementation the first year.
Okay, can the sleeve stretch out over time?
Back to what we mentioned, depends on how it was done initially and, of course, how you treat it afterwards. Very difficult, though, but it can happen.
I had a tummy tuck 15 years ago. Would that be an issue with surgery?
No, not at all.
Okay. Are there any medication restrictions after surgery?
I have a video on medications called at a category called NSAIDs. It's non-steroidal anti-inflammatory drugs. Medications mainly for pain, and those medications are really rough on the stomach, with or without a sleeve. You don't have to have surgery, but they diclofenac, naproxen, Advil, Motrin, all these medications, if you take them every single day, several times a day, they will put a hole in your stomach, with or without a sleeve. So those types of medications, and of course I coach you on that. You need to avoid them. It's recommended you avoid those.
Okay, after surgery, is there a need to use a spirometer to prevent respiratory problems? At the doctors here in San Antonio, they require a patient to use this after surgery quite a bit.
Yeah, I totally know about the spirometers. I only use spirometers on certain patients, not on everybody, because we get patients up and going 2-3 hours after surgery. You're not going to be for long periods of time in your bed. I need you to walk really quick. You're up and going fast. So in our case, we don't use them regularly on everybody. Just to bring in with 3 sleeves we did this morning, only one of them, a very high BMI, BMI 64, is using the spirometer. The other 2 don't.
Okay. What risks are associated with a revision from lap band to sleeve? Also, how long is the actual surgery? You've already answered that.
Surgery with a revision is a little longer. It takes us about 45 minutes to an hour. And that is because we have to come in and break down all the band system, including the port, get it out, and then work with the stomach. But that stomach, everybody reacts different to a foreign body inside their body. So the reaction in scar tissue is different on everybody, and that is what may increase the complication rate in patients coming for a revision from a lap band to a gastric sleeve. That is why, in our practice, we keep it safe. That is why we make sure the tissue is in good shape. Sometimes we have to do the procedure in one step. We can do it in one step. That means we can come in, we can remove the band system and convert it into sleeve in one step. Or we come in, we see that the tissue is really bad, we remove all the band system, unfold the stomach, we leave it as is, and we let it settle down for 6 months, and then we come back and we complete that sleeve, depending on the scar tissue and the quality of your stomach's tissue.
Okay. I've been considering coming to Mexico for surgery, but my family is nervous. They think going to Mexico is crazy. How can I reassure them?
Well, I know the big Mexico thing is always, I mean, you say Mexico and it's just, it's like, whoa, red flags, right? But we always, what I would recommend is you show them our content, all right? You show them my book. We throw out a lot of content there to show you how we really work. We're very transparent. We show you our facilities. We show you our hospital, the vans, the personnel, Rosie, the transportation vans, the hotels we work with, the way we do this every single day. And what they sometimes don't know is that having surgery in the States, well, you probably get a surgeon that has done this 100 times, 200 times, 300 times. And we have a lot of experience. We only focus on this procedure, and we've done so for the last few years. And that is the only procedure we do every single day.
Okay, I had an endoscopy in 1999 and have a small hiatal hernia. I have been on Nexium for about 15 years. I know the sleeve can worsen GERD. If this occurs, can I continue to take Nexium and continue to be effective? What is the probability I would have to convert to the bypass due to GERD? I have insulin-dependent diabetes, high blood pressure, sleep apnea. And then he's got a second question, but I'll let you answer that one first.
So that one, that patient, really, really good candidate for weight loss surgery, gastric sleeve. We go in, we fix the hiatal hernia. We don't charge extra for that. So just if you decide to come down for a hiatal hernia repair, cost is about $6,500. So that will not go charged to you. So we fix the hiatal hernia because I'm there already. We do your sleeve surgery, and your insulin dependence will change. Your Heartburn will help. It will get better in the next 6 months. Not right away because you already have GERD, but after surgery, down the road, next following months, as you lose the weight, your intra-abdominal pressure will get better, and all these conditions will get better too. You had a second question.
Second question, does weight loss typically improve muscle and nerve pain associated with fibromyalgia? Thank you.
It's the other way around. It's the other way around. Losing the weight improves it.
It says, does weight loss typically improve muscle and nerve pain associated with it? Yes.
Oh, yeah. Correct. Yeah, he's correct. Yes. It does improve. Yes. We have a lot of patients with fibromyalgia, and they lower the medications right away, and sometimes they're just off completely.
Okay. Is there any hormonal changes, such as low testosterone after surgery?
It's actually the other way around. When you're obese, it produces more estrogen and lowers your testosterone levels. So it's the other way around. It helps your body actually have a better hormonal balance.
Back to the lap band. What is considered in making a revision from lap band to gastric sleeve?
Well, it's quite simple. It's actually removing that band and performing the sleeve procedure. That's called a revision.
I guess they are there. Is there any candidate probably that have a lap band that you can't sleeve? Maybe that's part of the question.
There are some people who had bands, very old bands, 1999, 2002. First bands that were coming out caused a lot of issues in the stomach that I sometimes see that are not recommended to actually go forward and use that stomach for any other weight loss surgery.
Okay. How do you determine the bougie size for each patient?
We go standard 32 unless the patient is a low BMI, BMI 30-35. Then we go with the loose 32, and that gives you the best optimal weight loss down the road, maintaining it.
Okay. How long does food stay in the stomach?
Depends on, it's a difficult question because it depends if it's liquid or solid. So liquids with the sleeve, they pass through the sleeve fairly quick. And of course, solids stay there longer, but it depends on patient to patient.
Is that why you recommend not drinking, like 45 minutes before and 45 minutes after you eat?
Well, actually, that produces an uncomfortable sensation because the sleeve is so small that there's not enough room for the solids and the liquids. All right, so it's uncomfortable. Some people can do it though, but I recommend the first 6 months not eating and drinking at the same time. But if you're able to do it down the road, you can do it.
Yeah. I mean, you get to the point where that's not a problem, and you can drink a lot. So.
Correct.
Can the staple line pop open with time?
No. Once it's healed, it's healed.
The endoscopy and the other tests needed to evaluate if a re-sleeve can be performed, can they be performed at home and the results then sent to you for evaluation, or do the tests have to be performed at you?
No. You can actually, it's easier for you to test at home and send me your CD or DVD with the images or the result, fax it or email it to me, and I can tell you right away what needs to be done.
Okay. This is just a comment, I think. Thank God. I'm scared that with the years we will be able to eat much more. The sleeve will stretch a lot. So I think they were just commenting on you saying, no, it's not going to stretch. Mm-hmm. How long does the process take up to surgery to get approved?
Depends on the BMI, but to get approved this really quick because we receive the health history forms. You go into the Gastric Sleeve information website on the bottom. You fill out a health history form that's included in the package. It's really quick. You can fill it out on your phone actually, and that information is only reviewed by me. So I review your health history. I decide if you're a good candidate for gastric sleeve for our practice, and usually it's a turnout between 24 48 hours. We let you know if you're good to go.
This is an interesting question. I've never heard this question, but it's really a good one. Does this surgery affect having a colonoscopy?
Not at all. No, it's totally independent. Totally independent. Colonoscopy is not related whatsoever. No.
Okay. Do you think having a body compression garment like they use after having liposuction will help prevent skin sagging? And if so, is there a specific type and brand that you can recommend?
I don't recommend them because nothing has been proven that will help actually make your skin come back to place. So no. You can use them though. You can. I mean, if you like to use it, so like compression garments, Spanx, that type of garments, that's fine. No, nothing happens.
Are there any risks associated with flying within days of the surgery?
Pardon me again?
Are there any risks associated with flying within days of surgery?
Nothing. No, nothing. We've been doing this type of system and logistics for 9 years now, and no risks. No.
You know, I came in and I flew just a few days afterwards. The one thing that I did, and I think you guys recommended this, Dr. Alvarez, I didn't know how I was going to feel afterwards going back home, so I just, well, first of all, I took a light suitcase, so you don't want to take heavy. You don't need much of stuff in the hospital anyway. And then I just asked for a wheelchair. And
Correct,
I
yeah.
just had somebody take me between gates, and that was as simple as it was, very easy. Do you or can you fix a hiatal hernia during surgery?
Yes, I can. And if we see it, we always fix it.
Will this surgery help if you are bipolar?
Well, it won't help the bipolar issue, of course. That's totally independent, but you can have surgery. What we do in psychological, psychiatric illnesses, what we do is we do require a letter of clearance from your psychologist or psychiatrist.
Does this surgery have an effect if I have to have my gallbladder out?
No, getting us gallbladder out. So I have another video on that also on YouTube. You can type in gastric sleeve gallbladder, and you can actually watch that. But no, it does not mean you have to get your gallbladder out, as with the gastric bypass, which is different.
Is vitamin D important to take?
Vitamin D with calcium is good if you are if you're a woman, if you are in your fertile years, it helps prevent osteoporosis and down the road. But it's a multivitamin and some calcium with vitamin D is good.
There's a congratulations to Laura. She's just mentioning she has surgery scheduled with you the end of February.
Uh-huh.
How long?
It's a question from her?
No, it's not a question. She just made a comment that she's got surgery scheduled, so congratulations, Laura. How long does it take for the patient to be able to go back to the United States?
How long does it take? Patients stay with us 2 nights, then they stay an extra night in San Antonio, Texas at a hotel, and then they fly back home.
This one is from Ruth. She's having surgery with you on January the 15th, and she's going to be on a 2-week liquid diet. She's asking exactly what she'll be eating. I'm sure the answer is Susan will be sending her all of the information about what on the liquid diet.
Oh yeah, but in other words, pre-op diet is full liquids, creamy soups, drinkable yogurts, protein shakes, Atkins shakes, Slim Fat shake. But Susan will be sending you all this information. Remember, we take you by the hand in every precise moment. So she'll be sending you the information, and at any point you have any questions, you can always contact us.
You said no NSAIDs? How do you pronounce that?
NSAIDs, yeah.
NSAIDs.
It's NSAIDs.
Yeah, okay. You said no NSAIDs, even if they're enteric coated. I take it.
Well, yeah, even if they're enteric coated, that means they don't harm the stomach right initially. But once the medication is absorbed, they have a medication that actually thins the inner layer of the stomach, which isn't good.
Next question, do you send patients home with a complete copy of their medical records?
Yeah, we can actually scan them, send them to your email, and we do that quite often.
Okay.
I'm sorry. You do go with you do go home with the your copy of your surgical report, lifting restriction report. You get your prescription, the medications, and all that stuff too.
All right. You got another. This is a message from Gil and looks like Lyron. They said, Nina, please tell everybody that's listening right now and interested to have the sleeve with Dr. Alvarez that we had surgery with him 2 months ago and absolutely recommend them to do it. So just another
All right.
patient
Thank
list.
you for the cheers.
Yeah. Here's another. These same people are saying much better than the few doctors we had checked here in Los Angeles, California. Goes back to what you were saying, Dr. Alvarez, about how many have your local doctors done versus what you've done.
Yeah, thank you.
How many patients are you willing to sleeve in a day, and what is your limit each day?
It's a really good question because we focus on security number one, and we never jeopardize a patient. So in our practice, what we do is we only schedule 3-4 tops per day. There is no way we'll do more, even though we can do 10 a day, we can do 12 a day. The idea is to do surgeries only in the morning. That way you don't wait long. Surgeries were normally done by 12 noon. Patients don't have to fast that long. And of course, the most important thing is everybody in the team is nice and fresh.
This is another, not a question, but I just wanted to say that my sister had the sleeve done 2 years ago, December, and my wife and I will be seeing you for ours in 17 days. We couldn't be more excited and know we are in the best hands. That's from Catherine.
Well, thank you. Thank you.
Yeah.
Appreciate the words.
How long will it be before you can swallow normally without feeling like you're choking? A friend of mine had it done, and it's been 7 months, and she still has that problem. Wow.
Well, it depends on the procedure and who did the procedure. No,
Yeah.
that is no, that's not wrong. That's wrong. It should be that way. So I would check with her surgeon, see what's going on there.
Will having scarring, alopecia, permanent hair loss complicate or prolong my hair growing back in?
Well, if you have alopecia, that is a condition that you have as base. It doesn't mean it'll make it go away and make you regrow all the hair. So manage it as independently.
What type of insurance covers the surgery?
Well, it depends. In Mexico, it's not covered by insurance. So what we do is we do give you the medical information. We do give you the itemized bill, and you can actually submit it or claim it to your insurance company.
What vitamins do you recommend to keep up your energy level after surgery?
Again?
What vitamins do you recommend to keep up your energy level after surgery?
I recommend, well, it's not that sophisticated, so don't get overwhelmed. It's quite simple. Multivitamin is good. I like the one-a-day gummies, the Vitamin Craves. Those are good. 2 a day of two of those. Some calcium with vitamin D, and depending on the case, maybe some iron. But that's more than enough.
Okay, this is a little strange one. She says, oh, this may seem strange, but is it possible to get pictures of your stomach after you remove it? I'm being sleeved on January 30th, and I'm excited.
Yes, just let me know once you get here, because I get that request quite often. It's not that weird.
Is age a factor?
Well, it's not. It's as long as you are on the guideline range, it's not a factor. And out of that range, we've done patients as young as 12 and as old as 74, but the guideline is between 18 and 65.
Liquid medicines versus pill. While the sleeve is healing, do you have a preference?
Liquid, of course.
What do you need to do to prepare for surgery?
We can actually give you all this information once the patient is willing to step forward and book a date. We give you all the required information. We do all the testing down here. Depending on the medical conditions that you have, your age, you may be required to do something, but normally we do everything down here.
Well, I had an EKG. Do you require that each time?
Correct. It depends on the age. If you're over 50 or we see another medical condition, we do require an EKG, or if you had other heart issues, we'll probably even send you to the cardiologist.
Okay, here's somebody who wants to remind people. This is Victor again. Doctor, just remind everyone that having a good discipline and following instructions during this process is a key part of their success.
I totally agree with Victor, because it's important. That's why I stay in touch with Victor. I stay in touch with my patients, because I truly believe that giving you, inspiring you all, and giving you all this information and setting you an example is very important for you to be reminded every single day that you need to do your part with this procedure and keep you on track.
We have come to the end of all of the questions, so I'm going to try hitting this one button to unmute everybody. And Dr. Alvarez would love to hear where you're all coming from. So let me see if I can do this. Yeah. I'm thinking I could have just unmuted everybody with one button, but it doesn't look like it. So I'm going to begin to unmute everybody one by one, and you can just start telling where you're from. So let's see. Carol, Cassidy. So you guys can. There's a Kathy. Yeah. Deanna, Debbie. Seems like I could have hit a one button, but not. Can you guys just tell us where you're all from?
Connie Miller. I'm from Sacramento, California.
Hello.
I'm from Walnut Ridge, Arkansas.
Arkansas. Are you near
Paragould, Arkansas.
Yeah.
California.
I'm from California.
Indiana.
Whereabouts
California.
in Indiana? Whereabouts in Indiana?
Winnemac, Indiana.
Ah, I'm from Elkhart.
Ah, very good.
Yeah.
That's up north from me.
It is. All right.
North Pole, Alaska.
Paragould here today.
So I heard an Alaska one.
Tampa, Florida.
From San Antonio, Texas.
Hi, this is Patty from San Antonio.
Almost 70 degrees in Indiana today.
I know. It's beautiful.
Awesome.
All right.
Paragould, Arkansas.
Congratulations, all of you. I think I've unmuted everybody. If you haven't said where you're from, tell us where you're from.
Hey, this is Victor.
Florida.
Paragould, Arkansas. Grapevine, Texas.
South Carolina.
Georgia.
Florida.
Douglasville, Georgia.
Paragould, Arkansas.
Bethlehem, PA.
Yeah, baby.
Lakeland, Florida. Tampa, Florida.
Los Angeles, California.
Douglasville, Georgia.
Paragould, Arkansas.
Luis de la Cerda, San Antonio, Texas.
Oh, that's good.
Very nice.
Texas.
All righty. Okay, Dr. Alvarez is just saying, Nina, you muted me. Okay. Are you unmuted, Dr. Alvarez? Can you hear me? I thought he was unmuted. Dr. Alvarez, can you hear me?
I got it. I was able to unmute myself. How about that?
That's
It happened when you try to unmute everybody, and all of a sudden, like, I Nina.
Yeah.
It's not me. I can't say hello to everybody. Hello, everybody. Thank you so much.
Hi, Dr. Alvarez.
I really appreciate the time on a Saturday to if you're willing to learn a little bit about this. And, of course, as I told you a while ago, as a free gift, go to gastricsleeveinformation.com and you'll be able to download that file for free. It's a whole booklet, and it'll be a pleasure. If you have any questions, you can always contact my office, or you can always reach me via social media. Remember, I answer myself, and I'll be glad to answer any questions that you may have.
All right, we are done. Thank you all for being so patient. So I'm going to. All right.
Thank you.
And I'm glad it wasn't the whole 2 hours.
All
Thank
righty.
you, Dr.
Thank you, everybody. Thank you.
Thank you.
God bless.
Likewise.
I'll